All right, 3, 2, 1, action!
Hi.
Good morning, everybody. Welcome to Cockpit Convos. Your captain speaking, Jeff Britton. I'm excited today to have in the plane with me. Of course, if anything medical goes on up here, I'm covered.
Yeah,
because we got this fantastic, amazing nurse practitioner, Jenna Todd, who owns her business Refinement Aesthetics, with me today. Good morning.
Yeah, good morning. Thank you for having me.
Thanks for coming up in a plane.
Yeah.
Yeah, first time in a small plane with mono a mono, right?
Absolutely.
Yeah, I get a lot of first timers. What do you think?
Yeah. I mean, it's a little nerve-wracking, but this is very cool. I didn't expect to see so much farmland and very smooth takeoff, no complaints.
Hey, wait till the landing.
Oh,
That's the one you...
Make sure you get that
That's the one that matters. I'm 100% effective still. But hey, we appreciate you tuning in. And it's just today is another example of the power of networking and opportunity that we have. We've really known each other now for about 15, 20 minutes, and we already know probably a dozen people in common.
Yeah,
and some really deep connections too, because you'll tell your story, and we'll maybe dive into that relative to my son as well when we talk about your story. But no, excited to have you in the plane. Appreciate you coming up, and you know, for the audience out there, why don't you just give them the Jenna Todd story?
Yeah, thank you for having me. Thanks for the invite. So, grew up in Chesapeake, went to Hickory High School, and graduated and went to ODU, and I know I wanted to do something medical. My dad has been a firefighter he retired after 40 years. My brother is a firefighter, so I knew I was either going that direction or something with helping people, because I like medical. Went to ODU, and then I was young. I was like 17, and I went to this accelerated nursing program, and I was the youngest one. Everyone else was like in their 40s, so I didn't fit in at all. I couldn't go. They all went out for beer afterwards, and they
Sorry, I got to go home. Mom and Dad got a curfew.
Right? I was like antisocial. They thought I was antisocial, and I was like, no, I loved hanging out. I just couldn't go. I couldn't get in anywhere.
Right.
So went to their accelerated program, and then I graduated when I was 20. I was taking like 30 credits at a semester to get all the classes done between, I maxed out at ODU and then went to TCC to get more credits in so I could graduate early. I don't know, I was very...
Overachiever.
Yeah, I was crazy. Now I'm like, how did I do that? Because
were you always an overachiever? Like high school, were you on some sports team and you were trying to be number one? And I mean...
Not at all. I don't even know who I was. When I started college, I was a 360, right? So... I played softball growing up, and I was kind of a slacker. I hung out, and I wasn't the 4.6 high school.
Which came out after I went through high school. Yeah. That's weird.
And I know I had somebody apply the other day with a 4.6, 4.7. I'm like, the bar for me 4 was not even achievable. But I wasn't a bad student. I just wasn't,
Right.
So yeah, finished ODU's nursing program and. Pediatric ICU, this is where I did internships, and I knew, I just loved it. I loved everything about critical care and pediatrics, and so I started there in 2013 as a nurse as soon as I graduated, and did that for 7 years, and I knew I wanted to go back to school. I wanted something where I had more autonomy, and I wanted to do more. I kind of felt like I had capped out where I was, and went to South Alabama, and I did a family nurse practitioner program. So I was working 2 jobs while doing that, and I worked at Portsmouth Naval in their PICU for a little bit. So finally graduated FNP, or Family Nurse Practitioner School, and stayed at KD and got a job in neurosurgery, which I loved trauma. I loved anything fast-paced, and the hours were just a little crazy. You were doing 7 a.m. to 11 p.m. And, I loved it so much. I learned so much. I met the coolest people. But while I was doing neurosurgery, I had the opportunity to do medical aesthetics and injections. I had a friend who was really passionate about it and was working for somebody who they needed a more senior a nurse practitioner on staff. So that's kind of how I got into that, and I loved it. I could mix anatomy with the things I loved about neurosurgery, and just knowing facial anatomy and whatnot, and I got to kind of mix that in and also get really creative and look at the face as a whole, and I loved it, and I never thought I was going to find something I loved more than critical care. And
was it kind of a side hustle at that point, or was it?
I would call it a side hustle. I would do my 3-4 days at the hospital, and then I would do 2-3 days. It was a lot of days. It was
sure.
6 or 7 days a week, and
Okay,
yeah.
overachiever again.
Yeah.
I'm just still seeing the pattern here. All right.
I know. I slowed down. Now I say I slowed down. I picked up a couple different things, to be honest. So,
okay.
Yeah, and then I ended up leaving the place I was injecting after a couple years. Just wasn't a good fit anymore, and I have good friends that owned the buildings. They're off of Mount Pleasant. They're these. They used to be like a horse barn out there off of Mount Pleasant. So they flipped them and they created these beautiful like board and batten buildings.
Oh, cool.
And they were like, they knew I wanted to inject, but I couldn't find a place that I could do a part-time. Like I either needed to do the full-time hours but I wasn't ready to leave the hospital. So we went and took a look at it, and they were perfect. And they said, do you want to just inject here? And so it kind of fell in my lap to have my own place and have somewhere to still continue to inject. And that was me and my mom. Her name's Connie. Everyone loves her at the front desk now.
Okay.
And just me and her, not knowing, she's very businessy. She was in mortgage banking for 30 years. So from a business perspective, like she knows everything. She's the one that's going to find any mistake if it's there, right?
Okay.
So, but I have no business background. It's always been medical, and I'm like, I don't know what a P&L is. I don't know anything about business. And we were kind of like the perfect team that we didn't know, like we didn't even know we needed, I guess. And so she came on and she started working for me, and then it just started to grow and progress. And my 2 patients, I would get so excited. I had 1 or 2 patients. I'm like, this is the best, right?
Are they going to pay the rent?
Yeah, that was my concern from the beginning. I was like, I just want to make sure I was like, I'll just break even and I still get to do what I love. And so I brought an esthetician on to help me pay the rent. And she's still there. Her name's Emily, and she's wonderful. She's a master esthetician, does all the facials. And
is she 1099 or does she work for you?
She actually is her own business on her own business license, and I just kind of kept it that way because I was helping her out too.
Sure, she's a renter.
Yeah, she was just a renter, and we both didn't really know what we were getting into, and it grew to the point where if I didn't leave the hospital.
Oh, so you're still with the hospital at this point?
No, I left the hospital. Yeah, I set like a goal. I said, I'm going to leave the hospital after a year if this is going well. I didn't know how it was going to go. I didn't know if I was even going to renew the lease. And I left after, let's see, October, November. I left after about 8 or 9 months. I couldn't make it anymore. I was doing 7 days a week, and I would be at the hospital, and people would be trying to call. It was just me and Connie, so we were trying to like call and book appointments.
Can you get me in?
Yeah.
Oh, really? I'm in the middle of neurosurgery. Sorry.
Yeah. I was like, this is no priorities, right? And I just, I was losing business because I couldn't really focus on booking people and getting them in, and I just decided that if I don't have kids, and it's just me and my husband, and he has a great job, and if it was the time to do it, it was going to be now. And I gave the hospital like 4 or 5 months notice just because I knew it's really hard to fill that position, and it's a lot of training, and I helped them interview my replacements, and I just really wanted to keep my foot in the door just in case. You never know. You never know what you're going to have to get back to, and luckily, and it worked out, and I didn't have to go back, and I've been so blessed and grateful, and it's been a lot of like word of mouth referrals and like the different things that we offer. Emily still does the facials, and that her room is like the relaxing room, and my room is like
the pain room.
Yeah, the pain room.
Right, the torture chamber.
Exactly.
So we talked about how small the world is, and in your world of getting in the neurosurgeon, I got a question around that. Is that so? Some of the people in the audience know, some don't, most don't. So we had our twins were born, identical twins were born really early, like 1 pound 10 ounces, and Johnny had some complications with his hydrocephalus, which you know about, just fluid in the brain, ventricles. We got to go. That's a whole other episode. But anyway, so he's had 9 brain surgeries, and the last one was done by your doctor that you worked with, Dr. DeLustro. So small world here.
Shout out to Dr. D. He's wonderful.
So then I want to know, because he is a great guy, and I'm sure he was very attached to you. I'm sure very valuable to him. When you said, "Hey, Doc, deuces, man," what did he say?
It was awful. I went into their office, and it was him and the other attending, Dr. Conley, who I loved them. I really did. They were great to work for. And I sat down, and I was like blubbery crying. I could not stop. And he was like, I would leave too. He was like I
don't blame you. This place sucks.
Yeah, he was like, why? No, he was like, why are you still here? Like, I was like blubbery crying, and he was like, no, this is great. And he was actually really supportive. I mean,
that's great.
Yeah,
he seems like he would be that way.
Yeah.
I just want to know. He'd probably throw some cuss words or something in there and be a little crazy or something. But
I think it was, you know, just finding the replacement, and I think their biggest concern is like we make their life easier. You know, they go in and they, you know, we're always having to tell families awful things. It's the worst day of their life when you go in. You have to tell a parent that like you found a tumor, or you know them having an unsteady gait is actually a brain tumor, or you know their baby has hydrocephalus and it's going to need a lifelong shunt. Like you're having these conversations that are so difficult. And I feel like the nurse practitioners, the PAs that work for them, they deliver the terrible news. And sometimes it was us saying that news, but like we really would stay and really support the families emotionally. Any questions, you know, everyone has questions after the fact that they're thinking of. And like I and the other nurse practitioners and PAs were those people that really were able to comfort the families. And so I think that's the biggest thing when you have someone leave that really has good relationships with patients and families. And I mean, I still think about some of the patients and how their kids are doing. And,
oh, that's cool.
You know, because we see them for annual shunt visits and for follow-up and just, you know, how's the year been? Are they having headaches? And just you make relationships, and there's names that you know if they have constant failures, or you're like, oh, they're here, and you get to know them so well that they'll text me on your phone, hey, I just want to let you know I'm coming into the ER.
Oh wow.
So
got a shunt headache. We're coming in.
Exactly. So I don't know. That was tough to tell them, but they were really supportive, and they're great people over at CHKD. Their neurosurgery department, a lot of the departments, but they're great.
To your point, at the Miles of Hope Gala last week, which another mutual connection we have, there was I would guess I would call him a congenital heart defect doctor. I guess a pediatric heart doctor or something. I don't know. Anyway, really accomplished guy at CHKD. And he was the platform speaker, and he talked about just to what you said. He says, you know, one of the hardest parts of our job is you've got these parents coming in for their 12, 13-week sonos or wherever the sonos are, and they're so full of excitement and hope and the future and this baby and this, you know, college, all the stuff. And they do the sono, and he has to come in and tell them the tough news about CHD. And he's like, the worst part is walking out that door knowing the wake that I've just caused in their life.
Yeah.
Right? And it says, but we know we're doing everything we can to help them. We know we're early detection. We know we're doing a lot of good in that space, but it's tough telling these parents these things. It just kind of wrecks their future.
You've really changed their life forever, and you've changed their course. I mean, everyone, when you have a baby, there's so many things that you're worried about the whole time. You just want to have, you know, you're setting up the nursery, and you're thinking, like, how am I going to be sleep deprived, and how am I balancing all these things? And then they drop news on you like that, and nothing else matters. You're worried. You don't care if it's a boy, you don't care if it's a girl. You just want them to be healthy, and you want them to have a long and thriving life. And it's tough to have those conversations, especially in the pediatric world. So well,
let's bring it to more happy news.
All happy things.
Let's talk about refined aesthetics. And so me, I'm obviously. I don't want to categorize all dudes. But we're probably not much in the aesthetics world, right? As far as injectables or facials, and although we need them, I know we need all that stuff. It's just something I don't. Massages. It's just something we don't think about, right? And so talk about what services y'all provide.
Absolutely.
Right.
Yeah. So Brotox, we'll call it, you know, we should have passed
Brotox. That's funny.
Ago. It's picking up in the male space, because I think we're all about doing things that are going to make you feel great and good about yourself, and really, you know, just helping you feel like the best version of you. So the things that we offer, it's medical aesthetics. And I think my biggest thing going into this space was it was getting very frou-frou. It was getting very, like, taking medical out of it, treating these procedures like it was a hair appointment. And it's medications, and there's a lot of things that can go wrong if you don't know your anatomy and you know injections. And so my whole, I guess, philosophy of my clinic is an education-based clinic. You'll come in and you'll leave feeling like you know everything about what you're getting before you get it. And I won't come close to you with a needle or anything before I really explain, like, the medication I'm giving you. What's it going to do? What are the side effects? And it's always a choice. I tell every consult, we sit down and we talk about what we're doing, and then you make the choice. And if you decide to get it, then we can do it that day. If not, then think about it and come back when you feel good about it, right? So
cool.
We offer neurotoxin injections, which is Botox. Botox is just the brand name, but there's actually 6 different FDA-approved neurotoxin injections, and
what do these things do?
Yeah, so
do you stick it right here, and what's it doing?
So it stops the contraction of a muscle. So think about anything a muscle does at baseline. Your forehead is your only elevator muscle in the upper face. It lifts. So yeah.
All right.
We can talk. You know.
Yeah.
But we're gonna stop the contraction of the muscle in order to relax that muscle. So when you contract, you cause those deep, like those static lines.
Okay.
Think about it like a piece of paper. If I have a piece of paper and I folded your piece of paper over and over, you're gonna have a crease in your piece of paper. So when we initiate these neurotoxin or Botox injections earlier, then we prevent that deeper line from forming, so you don't get that crevice or that crease that then is hard to treat, because it almost becomes like a scar when it's that deep embedded contraction line. So we relax the muscles of the face in order to prevent those deeper lines from forming. The areas that most people come in and treat are the forehead, or that frontalis muscle, the area in between the eyes that cause the little 11s. So those are depressor muscles. So they go down and in, and they cause the 11s. And then
the 11s. That's funny. I get it now. The 11s. You know? That's funny. Right.
Yeah. And when you treat them, I know people will always say, like, I feel like people always think I'm mad, or you have a lot of
RBF.
Yeah, RBF, or patients that are on like TV, or patients like that are on podcast, right?
Okay.
Like, they want to present the best version of themselves, and it helps them feel confident.
Sure.
So, yeah. So when you inject into that muscle, it takes 2 weeks to kick in. Typically, fully kick in 2 to 3 weeks actually, and then we bring them back and make sure everything's settled, and it lasts about 3 to 4 months, and we see you back for repeat treatments, and it gets better and better, every time you treat, because you don't, typically have those 11s that were super deep at the beginning. We work on them, and we make it where they're not those deep embedded lines. So
that's cool.
Yeah, Botox is probably the most common thing, and that we do. The most repetitive treatment is where people start, and then we think about doing some volume replacement, right? I always tell my patients, when you clean your bathroom, you use 3 different things, right? Windex doesn't work for everything. So when you get into dermal fillers and volume replacement, you think about either people that have lost weight, or as we age, the fat pads in our face, they start to descend. So what do we do to support those fat pads? Just giving back to what you've already lost, not as much adding something that wasn't there before to make it look unnatural, but supporting those tissues in a way that you look more youthful. You restore that youthful appearance that you had a decade ago. So there's so many treatments that they've come a long way, but dermal filler, biostimulators, which basically means causing your body to create new collagen in response to like whatever we're injecting, which helps with the elasticity of the skin, just gives it a more youthful appearance. And then of course skincare. You gotta, if you buy the Rolls Royce, you gotta wax it. So doing all the skincare. Really laser resurfacing is what we do in my clinic as well. So
do you do that, or does your esthetician do that?
I do that, and then my nurses do that.
But that's not an esthetician thing.
It is if they're a master esthetician, which is like a higher level, they can do laser. But in my clinic, it's the nurses and myself. Emily can do it for sure, but I think I just keep the laser within the RNs and the NPs. And
I think Dr. Eva wanted the laser beam. Laser beam.
Yeah.
All right, so you said something, you termed it a different way, but my head went I called it a filler. You called it something, a replacement, or a...
like a volume replacement.
Volume, thank you. So where do you get the volume from?
Yeah, so a filler is... it's made up of hyaluronic acid. And
so you provide it. It's not like you're sucking it out of some place and putting it in another place.
Yeah, no.
Okay, got it.
It's in a 1 cc syringe. So 1 ml of filler is the size of a small blueberry. It takes 5 of those blueberries to make a ketchup packet. So it's a really small amount of filler. So when people hear, they hear syringes, it always makes them nervous. And I think you just have to look at every face so individually.
Right.
Some people have greater needs than others. And it just depends on, your anatomy. And some people have chin recession. Some people, when you think about the proportions of the face, where the chin is projecting makes a really big difference. If the chin is feminine, if it's masculine, you can really create a very natural result when you're thinking about what are the correct or the proportions of the face that are ideal, I guess, when you really think about a lip size and where are your lips projecting in comparison to the chin.
Wow.
Yeah, it's like art on the face.
I was gonna say you look at faces as a canvas almost.
Absolutely.
With what you can do with that.
Yep.
That's cool. Now, there were some other things we were talking about. I asked you about, I'm going to say it wrong, sclerotherapy or something like that?
Yeah.
So it's just not just the face you work on, right? You can work on other parts of the body?
Yeah, absolutely. We do a lot of treatments for the neck, a lot of treatments with the laser. We can do, we target brown pigment, we target red pigment. Sclerotherapy is great if you have like those spider veins that are more significant or like they're raised. You can do an injection. We don't do that there, but we do little cherry angiomas with the laser.
Okay.
Spider veins that are, that are flat relatively. You can hit them with the laser, and it's so cool. You just watch them; they disappear.
Gone.
Yeah.
That's cool.
Yeah.
How does the laser know how deep to go? You tell it like?
Yeah, you're dialing in. A lot of different lasers offer different penetration depths.
Okay.
So you're dialing in what you want and the energy that you want to deliver to a certain space.
Okay.
So you have protocols based on what you're trying to treat.
Yeah.
Little skin tags, easy to little blast off with a skin tag. Yeah.
Zap them.
Yeah, just those common concerns that you always see people cut. There's different clinics that offer more aggressive and invasive lasers, and I've got plenty of friends that I refer for that. But my patient population, I know them, and the downtime is just not something anybody wants to hear or have. So it just didn't fit with my clinic to have a more aggressive laser right now. But yeah, with that Adva laser is what I have. So we stay busy with that, especially because you can use it all year long. Like
Okay.
A lot of lasers you have to do getting into the fall and winter months because you have that downtime where you can't have the sun exposure, or you're going to make that pigment or the hyperpigmentation much worse if you like get a sunburn or while you're trying to heal. So it's a lot to take in and consider when you're picking equipment and what you're going to bring in. And yeah.
So when I was in Newport News doing that prior role with State Farm, I had this real big black, getting old, right? Big black spot on my head, right? And some guy named Matt, my buddy Matt, Coastal Laser or something like that. He would like zap it. It would go away, man.
Yeah.
It would come back. But it would go away. It would come back. Because I'm not putting sunscreen on my head.
Did you get derm to look at your big black dot on the head just to make sure
I did.
Okay,
Thank
good,
you.
good.
Yeah, I did go get checked out because I also got a little black spot on my ear. But they said it's all fine, just all good. So yeah, because actually, my wife just got a really nice, really big melanoma cut off her arm.
Yeah.
It did not the Mohs, but man, it was it pairs her a big deal. So she's fair skinned, and I'm like, give me the baby oil and let's get brown, baby.
Yep.
And I think there's probably some genetics and how her skin's made and all that stuff, but I don't know. I'm not a doctor. I just play one on TV.
Interestingly enough, pilots are at twice the risk for developing melanoma, and if you are up in the plane for 20 minutes at a 30,000 feet altitude, you are having the same exposure as if you were laying in a tanning bed for 20 minutes.
Oh wow!
So yep. So
really good to know.
Yep. And so anytime you're flying up here, like lots of sunscreen, lots of reapplication.
Okay.
It's
my wife will appreciate you saying that.
For sure.
Because I get it. We're close to the sun, right?
Yep.
So, and at definitely 30,000 feet, you're on top of Everest.
Yeah.
At that point, right?
Yeah.
So you gotta get a little. And I've heard about up there, man. If you take your sunglasses off for more than like 2 minutes or something, you get some burn on your eyelids or something.
Yeah.
Well, that makes sense. All right. So then, how big's your patient population now?
Oh man. So I think we have 1,000 patients in our. I know.
Look at you.
I know.
Look at you.
It feels really good. And
That's awesome.
We're booked and we're busy, and I'm just grateful. I think the difference is really that from the beginning, sit down with people, really explain things. It's not about rushing them in and out of the room. My consults are nice and long consults because I want to get to know them, and I want to provide them what is really, it's life changing. You really make them feel great about themselves. They get more confidence to get back out there, whether they've lost a spouse or they went through a divorce or they're not feeling themselves. They've gained weight or this,
Sure.
that, and the other. I just think making them feel like their best self is what I prioritize. So my consults are different, and I've been really grateful, and I feel like just hearing people out and not treating them like they're another number is really what has made us stood out from other clinics. And so when I got booked and busy, and my patients get mad because I can't see them for 8 weeks, 8 to 12 weeks sometimes, which is crazy. I brought on another nurse injector. Her name's Laura, and she's lovely, and she's just been wonderful. So she's been there. She's been injecting for 5 years, been at my place for a year.
Okay.
And then right after Laura, I had another injector named Kayla, and she's also wonderful. Come on. So they both kind of came on at the same time, and she was my first employee. So I was like, oh man.
That's cool.
So one came on, and then the other one fell in my lap after she came, and I was like, well, I guess we're taking 2. And then now I've got 3 front desk girls.
Wow.
Medical assistant.
You got a real own practice now.
Yeah, it's like a self-sufficient, well-oiled machine. So.
Now, do you have people, like you're in a plane right now?
Yeah.
So you're not doing consult. Are you the only consult, or do your injector do consults too?
That's a great.
Consultee, I guess, or consulter, I guess I'd say.
Yeah, so my injectors consult as well.
Okay.
I do all the medical clearances, make sure, kind of run through the checklist, make sure they're safe to have certain procedures, because there's certain diagnosis that would make them not a candidate for injectables. So they'll consult as well, and then we're very collaborative. If there's things that I'm like, man, I don't know what to do with this, I'll call up my friends, my buddies.
Wow.
Hey,
Okay.
So and then I have a second clinic that we own.
Look at you.
And then we just started a partnership with Reboot, which is a functional health medicine clinic.
We're Reboot patients.
Oh, I love that.
Yeah,
I told small world, right?
Yeah, exactly. Yep. I mean, Reboot, we're more functional medicine than traditional medicine.
Absolutely.
People, so.
Yeah, me too. I'm crunchy. I think I tell patients, if you've stepped outside like with no shoes on in the soil, botulism toxin is in the soil. You've exposed yourself to it. So I think people are very nervous that, I'm putting these things into my body, but it's something that it's found in the soil, and it's preventative. Preventative health care is so important, right? Yeah. Grounding.
There you go, man. Yes. Absolutely. My wife grounds every now and then on the reg.
Love that.
And that's why we can't pick your battles in marriage, right? How long have you been married?
We've been together 10 years, but next month, October will be 4 years we've been married.
Okay, so you pick your battles, right?
Yeah,
Pick your battles. And so we don't have like Kim Long, True Green come do our yard or any of that stuff, because we got to walk in the yard, man, and we don't want any chemicals in the yard. We got a grand dog that we don't want to get.
I love that.
And all this stuff. So, yeah, man, we're pretty crunchy in some of those spaces too, I guess you'd say. So, how much? Okay, talk about the pricing.
Yeah.
So how does somebody say, man, I'd really like to reach out to her, but I don't know if I can afford this stuff. You don't have to go specifically. Talk about affordability or how it works.
For sure. So when you look at Botox, the FDA has done studies for it's called the look of 3, right? Your 3 FDA approved areas for Botox is the forehead, and between the eyes and around the eyes, because all those muscles work together. So typically when you're treating the upper face, the look of 3 is something that you want to treat together, so the other muscles don't compensate. If you just treat your forehead, you're going to relax them and they'll look like a Neanderthal. if you don't like open them up here, right? So
that's funny. So you got to do all 3 at the same time.
Yeah. Okay. Yeah. Rule of thumb. There are certain situations where people aren't candidates for certain areas, but that's. Right. But typically you're treating those 3 areas together. So the FDA has done studies that says, hey, for this product to last, we say 3 to 4 months on average, right? For this product to last 3 months on average, this is the amount of how many units, it's sold by the unit, that you need to make that muscle and make that product last this long, right? Just dosing. Tylenol, we know dosing for Tylenol, we know dosing for Botox. I do use those numbers as a guide, and every patient is different. But typically, I would say for those 3 areas, for the look of 3, I would say anywhere from.
It depends on how much they need, right? Yeah, so you can't latch onto this number. She's gonna throw a number out there.
I would say, and I know it's such a wide range, but I would say for whether it's 2 or 3 areas, we're treating anywhere from 40 to 64 units, right? So I know that's a wide range, but people are different. I have 20-year-olds that have stronger movement than my 65-year-olds. So genetics plays a big key, lifestyle, how much you're in the sun, how much sunscreen you wear, So wide range, but it's sold by the unit. it ranges from $12 to $14 a unit with about 40 to 64 units. And
there
again,
you go.
Everyone's different, so I think the consult is important. Going over, like, if there's areas and everyone has a budget, right? So we talk about budget and where we need to stay in order for husbands, wives not to fight at the end of the night, and everyone to be happy. And yeah, we have payment plans too. And
that's why I asked about that.
Yeah.
Or memberships or anything like that.
Yeah.
Or, okay.
I'm looking into memberships. I need to really nail down how to make a good membership. And I think, when you offer a membership, it needs to be beneficial, and it also needs to really, when you're looking at what they're paying, you need to think about how is this different from all the other memberships where you feel like you're paying into this. Some of them I've seen where it's like $200 a month, and that's a big ask. So I want to make my memberships worth it. So
right.
I don't know whether that's giving away a free laser treatment with them, whether that's products that come with it, a free facial. So I'm working on that. I'm trying to businesswoman brain again, just trying to really figure out what's going to be the best and what patients would like the most to get free, I guess, with your membership, right?
Yeah, it might just be like you said, payment, like you're already doing payment plans. This kind of spreads it out, right? If I get 2 a year and it's $600, well, I'll just pay you $100 a month.
Yeah, exactly.
And
it's not that
come in
big.
Twice a year.
Yeah, that big investment, right? Right at that 3-month period. So,
all right.
Yeah, memberships are coming.
Okay, very good. So if they want to come see you, how do they get a hold of you?
So you can find us on Instagram. Jenna_NP.injector is my personal. I do a lot of my before and afters on that page. And then Refined Aesthetics Co. is our Instagram for the business. So our booking link is right through there. We have a website. Our booking site is through Vigaro, but the Instagram is the best way to be able to see who are you coming to? Are my injectors on there? You get to kind of feel out different personalities before you see us, which is nice.
Cool.
Yeah, and then my biggest thing is to come in for a consult and see if we're a good fit. There's
doesn't cost anything.
Yeah, no. We do the anything that we charge for a consult. It's $75 for a consult, but it goes towards your treatment.
Sure.
Yep, and it's only for the provider's time, and I'm really big about knowing your worth, and we do so much continuing education at my clinic. I fly all around the world to do trainings. I've trained with the best of the best in our industry, and continuing education is so important. There's always things that are changing. There's always new techniques, new products. So I'm really big about just education and making sure we're always staying up on the best treatments for different patients. And
that's cool.
Yeah.
Well, what's new? What do you think's coming down the line?
Oh, okay. So there's a really big push right now with growth factors, which are very interesting. So we do something at the clinic called PRP, where we draw your blood, we spin it down, and we draw off the growth factors. The plasma.
Okay.
So it's plasma. So and then when you inject the plasma, your body makes new collagen in response to that injury that you caused to the site. So your body will make collagen, right? So, but that process can be a little tedious to draw the blood, and not that that's difficult, but your PRP, or what you're getting from that plasma, is so dependent on the person. If you have a good diet, if you've been on steroids.
Yeah, garbage in, garbage out.
Yeah, exactly. So your quality of your PRP isn't always the best. So we've been really looking in and bringing in growth factors. So instead of using that plasma, you're doing something that's guaranteed. I know that in response to what I'm injecting, you're gonna make collagen, you're gonna make elastin, your body's gonna respond to what I'm injecting. Whereas we're not gonna test your PRP before we inject it if we're doing your own plasma. So I think that's really neat. And just bioregenerative.
So you said an injured area. Are you talking about you can do it in knees? Or are you talking about mostly face? No,
you're
talking about putting it anywhere. I do back, wherever the injury is.
I do it for hair, hair restoration.
Hey.
Yeah, which is lovely. Yeah, if you're a good candidate for that. And then at ortho offices too, I don't place it in knees, because a lot of the times, ortho will put it in joints, but it is regenerative, and the studies on it are great. So they'll inject it in joint. Yeah.
Yeah. Well, I've got a L5 issue.
Okay.
But I think that's mostly probably arthritic by now, but I had a bulging disc from doing Ironman back in the day. And,
oh man.
And it's just, they do this active x-ray thing where they stick these things in my facet joints and fill them full of love, I call it. I guess it's probably steroid or something. about twice a year. About every 10 months they kind of go in there and do that.
Helps a lot though, doesn't it?
It does, yeah, 100% it does. Because, man, otherwise it's total sciatica, and that sucks.
Yeah.
All right, then, so now how to get a hold of you, and all that stuff will be at the end of the video, too.
Yeah.
All right, fun facts. How'd you meet your husband?
Oh, man. Oh, gosh. Okay, so we don't tell a lot.
I mean, if you can tell it. I mean,
yeah, no,
okay.
we can tell it.
Okay.
I mean, it was 10 years ago. Plenty of Fish. Everybody was on Plenty of Fish. Not many people know that, so I just outed myself, I guess, to everybody. But we both are big beach people. We surf and we skimboard, and our first date was at the beach. We took I skateboard, too.
Cool.
Anything on a board. Board sport, I do it. So
okay.
Took our skateboards down to the beach, and I bombed this really big hill. Like, it was like this, like where the golf course is down at the beach.
Yeah.
He had a break board, and I didn't, but then he was like in love ever since, you know? Like, he saw me just like rip this super big hill, and after that, it was like love at first sight.
Love at first sight.
I feel like we've been together ever since, so.
Surf's up, dude.
Yep.
On the boards.
For sure.
Yeah, that's cool. Now, did you go to ECSC this weekend?
I didn't. I had to work. I really wanted to, though, because I really want to check out the new surf park.
Yeah. It's cool.
Yes, it looks incredible. All my friends have gone, and they keep sending me videos, and yeah, we're going to the Outer Banks next week, so for my birthday, so we're excited.
Okay. Have you been to the Dome yet for anything?
I have been to the Dome. I went to Teresa Caputo, like the medium.
Yeah.
You should get a medium up here. That would be
a medium. Oh,
like
that'd freak me out, dude.
Yeah, she'd be telling you all the crazy. You'd be like, I'm gonna land this plane right now.
Well, she could land it for me.
Yeah. So
in theory.
That's crazy.
Ever had any bad spills? Broken anything besides some hearts? Probably growing up.
Yeah, for sure. I broke. I used to do like girls skate camps and growing up too, like skateboarding camps, and I broke my arm and landed on that. Like, yeah, that wasn't fun. And then what else? I actually fell the other day, and I had to like lay on the. I'm not like young anymore. I'm not a baby, you know. I don't recover as easy, so I just kind of like laid on the ground and got my life together. But yeah, I have a one wheel. You know what those are? Yes,
I do. Those things are crazy, man.
Yeah. So yeah, I know. Like
the front back one wheelie, right? Not the side by side Segway kind.
Yeah, like the one that has one wheel and then
your front and back.
Yeah. Yep. It's yeah, like you ride it, you know.
Yeah, like a surfboard.
Yeah, like a surfboard.
Yep.
Yeah, they can be sketchy. They'll like turn off sometimes randomly. And you're going like 20, I mean, kind
of like cameras in an airplane?
Like cameras in an airplane, yeah.
Like ours just did.
Yep.
Well, so because have you seen the Segway version?
Yeah, where you put your feet, yeah.
Oh, beside it, and it's just a big wheel in the middle?
Yep. I saw somebody on it there's a dog on Instagram named Grayson that rides, he's a pit bull that rides a one wheel. It's incredible.
That's crazy.
You have to, like, no, it's not sponsored, but if you look him up, he's hauling ass. But his owner has the Segway one.
Yeah.
Like, and he's like directing him. My dogs would never.
That's awesome. Never. So you got dogs. Talk about those.
Those are like my babies.
Okay.
So they just turned 13, which is wild because it feels, you know, got them when I was young. So I still feel like they're like my babies. I don't have human babies yet, but Bailey and Bentley.
Bentley, that's cute.
They're supposed to be, I got one from Craigslist and one from eBay Classifieds.
Okay.
So they were supposed to be miniature Labradoodles, but one actually is. I got him from West Virginia, and it was super sketchy, but he actually is what he's supposed to be. But the other one, Bailey, is actually a miniature boxer doodle. She looked a little different, like, you know.
Never heard that one before.
No, neither did we. So, yeah, they're great. They surf with us. They'll get up on the surfboards.
Really?
Uh-huh.
Oh, that's awesome.
Yeah, for that magazine, for the Bridge Living.
Yeah.
I got Bailey up on like the wake surf with me. I had never done that before, but I put her in one arm, and I had like her, and I had like one arm on the wake surf, and I got her up for the first time. So that was cool.
That's awesome.
Yeah.
That's awesome. Have you ever been good at that? I'm gonna call it a wakeboard, but it's not what it is. A skimboard.
Oh yeah, so we fly out to we skimboard the most out of any board sport, actually.
Really?
We fly out to California typically to go to skim at least once a year. We actually just went to the competition in the Outer Banks.
Wow.
Yeah, love to skimboard.
I saw an Instagram reel the other day, and I would call it a California or almost a Hawaii-looking wave.
Yeah.
Where these cats, man, these kids, he got in the skimboard and like went in, and he was in the curl, man, and all that stuff. I'm like, wow, that's major skimboarding. Yeah,
that's probably like Laguna Beach is like the skimboarding capital.
Okay.
But yeah, like.
Who knew?
Yeah.
That you're a skimboarder, surfer, skateboarder?
Yeah, all of it. Give me a board and I love it.
Surf's up, dude.
Yeah.
Do that. That's awesome. All right. Well, I think I might know the answer. I was gonna say mountains or beach, but I'm gonna guess beach.
Ooh. Beach, but I also I don't like to be cold. Like I love to snowboard. I'll get a couple runs in, and then I'm like, all right, I'm ready to be warm again. So probably beach. Yeah.
Beach. All right. First concert, best concert.
Ooh. It's, you know, I thought about this the other day. I couldn't remember my first concert, so maybe it wasn't that event. Maybe Rascal Flatts.
Oh, that's a great
my
one.
Mom. Yeah, I mean, they're great. I don't know if it was my first one, but it was the first one I remember.
Okay.
And then like Morgan Wallen is always like the past couple, I've been spoiled. The past couple concerts I've been to, we just went to one in Miami, and I was probably like this close to him, so I was like, you know.
I saw it on your Facebook. Yeah, y'all were like looking at you, man.
Yeah, for sure.
That was cool. Yeah, everybody's Morgan Wallen. I remember I took somebody up the other day that talked about best concert was Morgan Wallen opening up for Luke Combs.
Oh, wow.
Back before Morgan Wallen was big Morgan Wallen.
Yeah, now he's too big for his britches. No.
Yeah, I'd like to go see him sometime. I hear it's a big deal.
Yeah, he puts on a great concert. He's definitely up there, so that's probably my favorite. If you see this, I want to go fishing, so I love to fish. So I want to fish with Morgan as like my, you know.
Morgan Wallen. I'm going to tag him. This might be the biggest YouTube video I ever do.
It's on my bucket list. I'm good
We've
luck.
been fishing with Morgan Wallen. Hey, you come to the 757 or Virginia or anywhere probably in a 3-state radius, you're going.
I'll come to Tennessee. Like, I'll go to Knoxville. That's fine.
That's awesome.
That too, yeah.
Fishing with Morgan Wallen. Now, you realize if you do that, you got to with your husband, bring a brother along here. Let me just be like your film rep or something. Let me be your, hang around with that, man. It'd be kind of cool to experience.
He could be on this podcast. We could bring him up in the plane. We're going to have to upgrade the 3-seater maybe, and we can interview him.
I get a feeling his A&R person's not going to allow Morgan Wallen to go up in a tiny airplane. But you never know, man. He does a lot of crazy stuff. He throws stuff off tops of buildings. Why can't he get in an airplane with me?
Live your best life, you know?
Absolutely. Well, I tell you what, Jenna, you've been really cool to get up here. I've enjoyed getting to know you.
Yeah, thank you for having me.
I'm proud of your amazing practice of having 2 clients, and now you've got more than 1,000, multiple locations.
Thank you so much.
And I think it's been really cool. And so, you know, I'm going to put up all our contact info at the end of this, and you can also check, I don't know if people don't know this, I just did this week, thanks to an inspiration from a guest in the airplane. We're now a full Spotify, Amazon, Apple podcast, the whole shooting match. It's not just YouTube. So check it out on those channels as well. You know, Cockpit Convos on that. And we're going to sign this thing off. You ready?
Yep.
All right. Well, thanks for being on here. 1, 2, 3. See ya!